Myself a little bit. My name is Jen. I am an occupational therapist and certified hand therapist, as well as a lymphedema therapist. I've been an OT for about 16 years, and I've been a WinBack user for, I think, around 5 to 6. So over the course of the time that I've been using the devices, it's been really kind of interesting to see like how the different patients respond to it with the different diagnoses, and really try to really truly see like how beneficial it could be in tissue recovery and pain reduction. So just a little bit of a background about, let me see here. There we go. A little bit of a background about mostly what I've been treating recently. A lot of tendinopathies, tendonitis. I think the one thing that we saw with COVID, with a lot of people working remotely, is that poor ergonomic setup, bad body positioning. They really just had a lot of issues with tendonitis. So WinBack has been really instrumental in helping those individuals. We get a lot of patients with hand OA, wrist OA, chronic pain, ligament sprains and strains. At Hopkins, we have a POTS clinic, and a lot of those patients also have hypermobility spectrum disorders. So we see a lot of those patients that have just chronic joint pain from hypermobility. And then even to the post-surgical, where we can use the WinBack for edema reduction, pain management, scar mobilization. It really has been a great tool for us to help expedite our patients in getting through their recovery. So I have two cases I'm going to talk about tonight. The first is a 38-year-old female. She has chronic wrist pain. She's been to therapy multiple times for flares of her wrist pain. To give you an idea of some relevant medical history, she is among those that has a hypermobility spectrum disorder. She has fibromyalgia, chronic wrist tendonitis, carpal tunnel, both hands. Her occupation is a lot of work on the computer with graphic design and typing. And so she comes to us frequently when she's had an increase in her workload with FCR tendonitis, fascial muscular tightness in the forearms, and it's really interfering with her ability to do work and just daily activities. So we started introducing WinBack with her. The WinBack 4 has been really great. She's really gotten a lot of pain relief from it. And the setting that we use mostly is RET at 30%, and we do 5 minutes at each wrist just to kind of really get a targeted treatment at FCR near its insertion site to really try to get that tendonitis to heal. So I have a video here that just kind of shows about 30 seconds of the application just to kind of show how the WinBack 4 can be used in this area. So we have the grounding plate that we have strapped to her proximal forearm, and then we can really work in a very targeted area in her wrist. We normally will follow this by doing some sort of fascial work or instrument-assisted soft tissue release. We give her wrist stretches. These are the settings that you can see on the device. It's a little zoomed out, so I apologize, but RET 30%. We include postural exercises, ergonomic education, and strengthening. And it's been really, really helpful for her in her recovery. So for her, when she came to us, she had wrist pain that was an 8 out of 10. We did about 8 treatments, got her down to about 2 out of 10. She's been able to tolerate typing for longer durations with less pain. She's been able to do more computer work, and our plan is to discharge her at the next visit to our home exercise program with the goal that she will maintain the results that we've gotten with the use of the WinBack and the extra exercises that we've done. The next case, this is a newer case for us. It's a little bit interesting. So she came to us with a diagnosis of CMC-OA as well as chronic Dequer never had therapy before. She did receive a cortisone injection, and we fabricated a custom orthosis for her. But when she had her MRI, they actually found that her Dequer was so severe at the first dorsal compartment that she has a near full tear of her EPL and small partial tears of APL. So they did a cortisone injection. She got some relief, but she really wasn't fully happy with the results. So they said, try therapy. So we've been a little bit more cautious with her in what we're introducing to that area, to be cognizant that she does have partial and near full tears of tendons, and we want to prevent that. So for her, what I've used is a more topical setting, the CET at 20% lower intensity for 8 minutes in the first dorsal compartment. But the nice thing about the Winback 4 is that this one has a wand that they can hold in their hand as opposed to needing to strap the ground plate to their forearm. So you can really get a better application of the treatment to the target area. And the therapist that's in this video was using the bracelet so she could really kind of hone in on EPL and APL and deliver the treatment where it was needed to try to get some of that inflammation to reduce and for the pain to go away. So the video you can see here, the patient is holding the wand in her hand. The therapist has the bracelet on her forearm, and she's just going to work a little bit. She's a little bit more volar here. I didn't do a long video, but she does eventually move more radial and dorsal. But it's nice because she can really just kind of hone in on exactly where the problem is to try to get some tissue healing. And the patients love the way that it feels. And, it's just like a very subtle warmth. It's not painful. They give us feedback if we need to adjust the settings to make it more warm or less warm. So it's a very customizable treatment to get them some relief from their pain. Okay. And so I don't have a ton of information about her outcomes, except for that after her first visit, which was earlier this week, her pain reduced from a 5 to a 3, which is it's a decent reduction after one treatment, but I anticipate that after we're able to do it more consistently, that she will get significant pain reduction. And then the goal will be gradually to get her out of her orthosis and doing some protective thumb movements so that we're not overstraining the tendons so that she can function, because she is somebody who she lives independently. She relies on a rollator. She has some other medical issues that she's dealing with. And so we really just want to make sure that she's as functional as possible. And I'm really hopeful that the Winback is going to help us get her there. I was hoping to have a surgical case for you. I think the problem that we're having right now is one of our hand surgeons is moving to the Middle East, so our surgical cases are just a little low. I can tell you in the past, I have used it post-operatively for the things that I've mentioned. So for somebody who has post-operative swelling, using the mixed setting is a really nice way to dilate the vessels and then follow it up with retrograde edema mobilization or manual lymphatic drainage to try to get that fluid moving. It's a really nice way to kind of combat some of that post-surgical pain that's preventing patients from wanting to move or feeling comfortable moving. So there really are a lot of great applications for the wrists and hand. And if we do another webinar in the future, I hope to have some examples for the group because it has been a really useful device. And then if anybody has questions.
Jennifer, that's great. I would like to go back to case number 1. Let's go through that a little bit. I'm curious about the exercises. Like what are the top 2 or 3 exercises that you hear yourself giving over and over to patients with wrist hand issues?
So with wrist and hand issues, it really depends on the source. And so for her, somebody who does a lot of repetitive work on the computer, it really started with posture and scapular stability, proximal stability, and then gradually working down to the wrist. So we work on scapular strengthening, stability at the shoulder. We work on stretching the wrist flexors, wrist extensors. She does have some nerve symptoms, so we incorporate median and ulnar nerve glides just to try to calm all that down, and then really encourage that as she's going through her work throughout the day, that she's taking the necessary breaks. If she's feeling symptoms emerging, she's taking a break. She's proactively doing her stretches so that she can reduce, the repetitive strain that she's causing from the work that she does.
Good, that's helpful. And any other takeaways that you recommend for them to do at home? Do you recommend any topicals, supplements, anything that you put into your program that might be helpful for the other practitioners?
Sure. So in Maryland, I'm a little bit limited in what I can recommend in terms of supplements. I'll usually say, if you've had a conversation with your doctor about a supplement that you've read about and they don't think it's going to interfere with any of your medical conditions and it's safe to try, then sure, try it. I will go through a list of topicals with them just to see what they have tried, what they've not tried. Again, just keeping awareness of what their past medical history is. I have had one occasion in the past where a patient was given Voltaren topical gel, and it caused elevated liver enzymes. So with knowing that, like, I think they've reduced the dosage of that now that it's over the counter in the US, but I'm always just things like that. I just always encourage them really talk to your physician because I don't want to recommend something that could potentially cause a bigger problem. At our clinic, we do have samples of BioFreeze and Stop Pain, and I hand them out, tell patients to try it. If something works for them, you know, I help them find where to get it. But a lot of times it's been a little bit of trial and error.
Okay, that's helpful. Any
Mhm.
other questions or anything that you want to share with us, Jennifer?
It looks like Grant has a question.
Do you have any pointers on how to have the mix head not lose contact when working on DeQuervins, or do you use MIX right there?
That's a really hard area, especially if you have somebody with a smaller, more petite bony wrist. I've had more success with somebody that has more bulky musculature there. That's why I tend to go more towards like a CET or an RET with a bracelet, because that way you can maintain contact with just your fingers and you get a better result.